Can everyone hear me out there?
Yes.
Okay. Everyone's feeling shy today. I can't see anybody. There's Whitney.
I'm sorry, I would, but I don't have a web camera in here right now.
That's all right. That's all right. I know it's Friday.
Ken.
Okay, so everybody ready to go? Okay, I'm gonna before we get started, I just want to say a few things. I normally jump straight into looking at our surveillance report, and I was going to do that today. But I think it's important that I take a couple minutes to just talk about where we are before I jump into the numbers. The numbers I'm about to share are dire. Across the county, we're seeing rapid, widespread, sustained, and frankly, uncontrolled transmission of COVID-19. Most of our nursing homes and assisted living facilities, most of them have active cases, and several have outbreaks with numerous cases, and as many as 10 to 20 active cases in some places. Our hospital right now, and we have Kelley from the hospital is with us today to answer any questions. But our hospital right now, like many of us, are struggling to maintain staffing to provide care, and they're now implementing measures that include bringing asymptomatic close contacts. So not people who have COVID, but people who have been close contacts of people who have COVID. And they're asking them to come back to work before the end of their quarantine period. Again, I want to make clear those are staff that don't have the disease. They haven't tested positive, but they've been exposed, and so they're at higher risk for developing it. I'd also note that just next door in North Dakota, some hospitals apparently are being forced to ask COVID-positive staff to come back and provide care. That is a bad situation to be in. Our schools are being forced to move to remote learning in some cases because they don't have enough staff to keep the schools operating. Our teachers and administrators are working their hearts out, but they're tired and they're stressed, and some of them are sick. Your health department, we're seeing so many cases from so many labs and sources that we're struggling to record and enter them into our systems, much less provide the type of contact tracing that we would like to in order to limit spread. We're still working hard. Make no mistake, we're continuing to do everything we can to reach everybody we can. But it's stretched past our capacity. Those who need tests are now waiting longer, sometimes as long as 7 days. And we haven't even yet seen influenza hit our community. And when it does, demand for testing is going to rise and the system will become more stressed. As a community, we have a choice, I think. The first choice is that we come together, we think of those around us, we stay home when we're sick, we stay out of large group gatherings, and we stay out of places like bars and parties. If we can do that, we have a chance to limit disease spread and continue to operate schools, keep seniors safer than they are now in nursing homes and assisted livings, and to support our healthcare providers who are out there working to serve all of us. But to make it work, we need everyone to do their part, to wear a face covering, to stay home when they're sick, to wash their hands. We need establishments like bars to follow public health rules and do things like close at 10 p.m. And we need help from law enforcement, both at the city level and the county level, to help us enforce those rules. And we need support and leadership from elected officials of all stripes and levels to work together to help lead us through this pandemic. This won't be easy, but the alternative path is much harder. The other path leads to more schools forced to close due to lack of staffing. The other staff leads to hospitals, such as those in Billings and the Dakotas, with full intensive care units and crisis standards of care. The other path leads to more cases in nursing homes and more funerals and more sorrow. Now, I know everyone's tired. No one is more tired than those of us in public health and working in nursing homes and hospitals. I know we all want this to be over. And thank goodness there is some light in the future. There's a possible vaccine that looks like it might work pretty well. There's better treatments, and our doctors and our nurses have a better understanding of how to care for people who have the disease. We will get through this, but we have months ahead of us before we get to that brighter future, and we will all be better off if we work together and we take care of one another and think about others as we go through our daily lives. We need your help. That path is ours to choose. With that, I'm going to share the numbers that I think are most relevant in our weekly surveillance report. Eric, can you see that? I can see you. Give me a thumbs up if you can see that. You can still hear me? I take it. So the first slide, the first item on the report measures the 7-day rolling average of cases per 100,000 people. That has now risen to 133.8 cases per 100,000. You all know we had one day this week where we got close to 300 cases in one day. Just to put some context in this, the Harvard model for pandemic control really identifies the level of about 25 cases per 100,000 as a tipping point level. And so we've blown by that by about 5 times at this point in time. The next item is our positivity rate. I think for the first time, our positivity rate is now past 20%. That's comparable to what we're seeing statewide. And again, to put this into some perspective, the World Health Organization, CDC, and others consider a positivity rate below 5% is where you want to be, and above 10% as an area of significant concern. I have seen literature out of the Children's Hospital of Philadelphia saying that at 9%, communities should think about going to remote learning in schools. It really is an indication of rapid transmission of the virus in the community. The median time from specimen collection to date received by public health, in other words, how long it takes for people to get their test results back, that has now moved past the 2-day mark. The median time is 3 days. What we're seeing is high variability. That's what you see in this slide here, is the number of days from specimen collection over the period of time, November 1st to November 10th. We're puzzled because we were hearing anecdotally a significant number of people waiting for 5, 6, 7 days. And our median time hadn't moved to that extent. But when we look at it, you really see high variability, and I suspect that has to do with where the tests are going, where the labs are. But you're seeing still a fairly significant number being turned around within a day. I would imagine that the number that were turned around in the 0 days are probably antigen tests that were done in the same day. And we're still getting, thankfully, the most common return time is a day. But you can see after that, you really kind of it really is a crapshoot whether or not you're going to get it in 2 days or a week. That's very concerning, especially since we don't yet have influenza that we've detected in the community. As soon as we start getting influenza and some of the other illnesses, the demand for this testing is highly likely to increase and probably put more stress on the system. Need people to be aware of that and understand that and be prepared that when they go get tested, they may be waiting for longer than they have been through the summer and early fall. This, again, we might stop reporting this in the future. I wanted to share it, and not because I want to be transparent, and anybody who asks, we'll give it to you. We'll keep tracking it. But it's becoming not a great indicator of where we are. What this is showing, and what typically would trigger this, is when we enter a case into our system and we start that investigation, we need to get those cases entered into our system so that we can continue to track cases. But we're falling behind in our ability to get in touch with people within 1 day. So while this is a good indicator now of how we can get cases entered into the system, it's not great in terms of how successful we are at getting in touch with people early. And so we're going to continue to work on that. I just want to communicate to you all that this is taking longer. And this delay in days in testing is really significant. But when we are getting so many new cases from so many directions, an example would be yesterday. The number from yesterday will very likely be revised because we got a big dump of new cases right at the end of the day that didn't get entered. We want to share that information, the best information we have, in a timely way. But we're running behind. Symptom onset date, when people are getting sick. Again, I say this every week, but that on the far right, that's incomplete data. We haven't had a drop off in symptoms. We just haven't gotten to these interviews yet to understand when their symptoms started. You're just continuing to see a large number of people become symptomatic over the last, really since the end of October. I'm going to spend a little time on this slide, a little bit more time than usual. This is the age breakdown by decade of people, and you can see that red line is people in their 20s, followed by fairly close behind by people in their 30s and 40s. And you can see that increase in the 20s started about a week prior to the rest of the groups. I think it's important that we draw a connection here between what we're talking about and people in their 20s and what we're seeing in hospitals and nursing homes and assisted living centers. And I don't want to paint too broad a brush. I'm certain there are people in all age brackets, including their 20s, who are taking this very seriously and doing everything they can and volunteering and taking care of each other. But the fact of the matter is we're seeing a huge number of cases of people in their 20s. When we scroll through them, it's just impressive how many of the new cases are in the 20s. It's one after the other. We need a little bit of analysis on this because I think it's important to connect why this matters. We looked at the number of cases that we have associated with long-term care facilities. And we looked at the age category of those cases. And you would expect in long-term care facilities that the age brackets would skew pretty high. They serve seniors. What we're seeing is that since the beginning of the pandemic, we have almost 78 people under the age of 30 who have been placed in isolation and quarantine due to the fact that they either are a case or they're a close contact of a case. That is more than 3 times the number of people that we have in the 30s. It's more than 3 times the number of people we have in the 40s or 50s. why this matters and why I'm making this connection is I want people to understand why we care so much what happens in bars and parties and in those social settings. It's not to pick on people in a certain age category. As I said, I know that there are people in all age categories who really are trying to do their best. But we're seeing cases in those long-term care facilities, and those cases are a result of community spread. And they're coming into the facilities in part from the people who work there, who live in the community. And it might not be any fault of their own, but they live in the community, they shop in the stores we shop in, and there's probably a percentage of them who are in bars and going to parties. And so I think it's very important that we make that connection, that what we're seeing happening in nursing homes, in assisted living centers, in hospitals, we're seeing cases and we're seeing quarantines associated with people who are fairly young. And that's why we're focused on trying to limit those interactions and trying to talk to the community, and why some of our public health rules are oriented toward limiting those sorts of interactions. What happens in those parties, what happens in those bars matters to what happens in nursing homes, assisted livings, hospitals, and schools. We continue to see growth at MSU. Again, I think it's comparable to what we're seeing in that age category generally, but it's significant. We've mentioned that MSU has been pushed to its capacity on isolation and quarantine space. They're coming to the end of their term. I think it's going to be a long, I think they're going to make it to the end of the term, but there's really significant questions about how they'll manage to come back in the spring, and in an environment that's probably going to be significantly more difficult than what we saw in August and September when we started classes. We've included again the active cases in schools. That list is getting longer. And you can also hear there's a connection here to the DPHHS website that will show you cumulative cases. We've decided to use active cases because I think that's information you don't have elsewhere. And it gives you a bit of a snapshot of where we are right now, and gives parents a bit of an idea of where we have cases right now. Bozeman Health and Kelley is on, and she can speak more in detail of this. This is a snapshot in time, I think, from this morning. We had, of the 20 critical care beds, there were 2 remaining. This is very highly, it changes a lot, and it can change a lot from 1 hour to the next. Non-critical care beds, about 76% occupied. I just stress here, I think it's important to focus on beds. I think it's also really important to focus on the people that are serving the people in those beds. And they're tired and they're worn out too. They've been doing this for 9 months as well. This is their 3rd surge, and along with all the rest of us. So with that, I'm happy to answer any questions. Kelly Kajawa from Bozeman Health is also on the line and can answer questions specific to the hospital or care providers as well. So if there's questions out there, I'm happy to take them.
Hey Matt, it's Perrin. I was hoping you could tell us what sorts of, if you've had any issues with compliance with the new health rules that were implemented last week, and how you guys at the health department are working on enforcing that.
Yeah, we've gotten reports of a limited number of bars that have elected not to close, and we have referred those to the county attorney and to the local law enforcement. And we're actively working with those partners and trying to find ways to bring people into compliance and if necessary, force them into compliance. We take it really seriously. We're actively working with the county attorney, has been very helpful. And we're trying to get assistance from local law enforcement to help with that as well. Other questions?
Hey, Matt, this is Emma. So obviously we just talked a little bit about the new restrictions that were put in place a week ago. With the still rising and the still increasing cases, do you think that there could be any more restrictions in the future that go beyond the constraints of just bars and restaurants?
We need to focus on what we've got right now. Let's focus on the restrictions and the rules we have in place. Once we get compliance there, once we get those in place, let's see where we are. But I'll tell you, without more support from the federal government for people who are put in a position of being out of work, for small businesses and large businesses that potentially go out of business, it's very difficult to think about additional restrictions. It's very difficult to think about things like a stay-at-home order, and it's very difficult to do that as well when you're in this really period of political transition that we're seeing at both the federal and the state level. I don't see that. Our focus right now, Emma, is on the rules that we have. That was just a week ago that the new Board of Health rule came into play, and we're really focused on getting that implemented before we go any further than that.
Okay, thank you.
Yep. Other questions out there?
Matt, this is Perrin again. I just wanted to ask, you've been talking a lot about how your contact tracing capacity is really limited. What sorts of changes have you guys made at the health department? Like, what does that I guess challenge look like for you guys?
Yeah, it's a good question. So what hasn't changed is our team is working as hard as they possibly can, but we have changed the way that we do contact tracing in order to be able to do everything we can to get to people who are most at risk. And so we've talked in the past about those interviews that we do have gotten shorter and much more direct and much more oriented toward identifying close contacts and identifying people who are at risk, who are in sensitive settings or who have a sensitive health condition, and making sure that we're identifying those folks and making sure that those people are aware that they might be putting others at risk. We continue to add contact tracers, both through our own staffing and with MSU. And we continue to just work really hard and refining our processes. Early on in the summer, we added some software that really was somewhat of a game changer and it made us much more efficient. But those are the things we can do right now. The other thing we're doing, if you look at our website and you go to our COVID-19 section of our website, you'll notice that there are some entry portals there that are designed specifically for people who are seeking information, either because they've been diagnosed or because they're a close contact or they believe they're a close contact, or maybe they have questions about testing, or maybe they're an MSU student and they have questions. And that's designed to provide people with a direct way to get that information. In the past, what we've been doing is calling people within a day and having those conversations with them. Since we're not able to do that in a timely way, we're trying to create those resources. The other thing that I would say we're doing is we're putting more of our contact tracers into our call center so that when people call, they have more direct access to nurses and public health professionals who have that contact tracing background, have access to our electronic medical record, have access to the state test site and can provide that information in a more direct way. So all those things together, we're trying to make our services more sort of self-serve for people that we can't get to, and we're also continuing to add staff and refine our processes.
Have you considered or have you asked the state for assistance, like additional workers or anything like that?
We continue to add staff. We haven't asked the state. We have asked, in some ways, we asked the state for assistance with the MSU contact tracers and making sure that we had dedicated staffing to MSU. We have been working with Bozeman Health as they provide some services to some partners in Big Sky, and they'll be, I think, adding some contact tracers in Big Sky that we'll be working with. But I haven't put out that call to the state because, frankly, we can keep adding people locally here. It's not really a matter of the supply of people. It's just that the case numbers are growing so quickly that really contact tracing can help us track the pandemic. It can help limit spread in some ways, but when it gets this big, we really need help from the community. And so we're putting more focus on that community help to limit the spread, because that's what's going to take right now. Contact tracing is not going to end this. What's going to end this is people doing what they can to limit spread by staying away from others when they can, wearing face coverings, washing their hands, staying home when they're sick, and really being careful generally.
Matt, this is Aaron Bolton from Montana Public Radio. You mentioned that MSU is running out of their ability to quarantine and isolate students at the university. Can you just talk about some of the risk if they were unable to isolate folks in the spring semester, and then also whether or not the county health department is in talks with MSU about what the spring semester might look like?
We're in talks with MSU all the time about all kinds of things. We haven't really gotten to the point of making calculation. That's a much bigger decision than just the local health department talking to MSU. That includes their partners in Helena, and that's and their faculty and their students, and that's a complicated decision. I would say this: I would urge you to reach out to Tracy Ellig at MSU and others, because I think what we've heard the last couple of days is that where they were reaching capacity in isolation and quarantine, that may be abating a bit as we get so close to the end of the term, when students, on-campus students, are identified as somebody who needs to go to quarantine, especially if they're local, if they're Montana students. Some of them are electing to go home and quarantine at home, and that's certainly, there's some risk involved in that as well. But if it can be done safely, that does take some pressure off of some of the on-campus housing. But if we get to a point, and it's a concern of mine, I think it's a concern on MSU's, going into the spring term, when we're likely to have a much higher incidence of COVID-19 in the community at the starting point. We're starting at a much more significant level of disease in the community. The demand for that isolation and quarantine is likely to be greater, and I'm confident MSU is thinking about that. Right now, I think they're focused on doing everything they can to keep people safe in the current term, and getting through the current term, and then moving on to the next decisions after that. Other questions? Kelley, did you have anything that you wanted to say, or did I mess anything up that you want to fix?
No, you did an excellent job, Matt. I really appreciate you reiterating that we are not bringing confirmed positive COVID individuals to staff our hospital. We are bringing people in after a period of quarantine, after being exposed, and ensuring that they're asymptomatic by doing checks during their shifts and requiring that they check symptoms before they come into the building as well. So thank you for reiterating that point.
Sure. Any other questions for me or Kelley? All right, I hope you all have a good Friday the 13th, and I will talk to you next week, I'm sure. Thank you all.